My name is Donna Green, and I'm a speech language pathologist for Speech Therapy Plus. We're a private practice company in Eastern North Carolina. We have 3 office locations, one in James City, one in Cape Carteret, and one in Morehead City. We also serve daycare, schools, Head Starts, and homes in Carteret, Craven, Onslow, Beaufort, New Hanover, and in Pitt County. As a speech language pathologist, we primarily evaluate, diagnose, and treat various communication disorders. The main umbrellas of the disorders that we treat are speech disorders, social communication disorders, language disorders, the cognitive and communication disorders, swallowing disorders, oral rehab, augmentative and alternative communication, and accent modification. As a speech language pathologist, there are lots of different settings in which you would find us. The majority of SLPs find themselves in the education setting. A recent poll was 56%. And this would be, your early childhood and education. This would be your preschools, your early intervention, and your K-12 schools. You might also find an SLP in colleges and universities. And their role there would be to teach, to research, and also to supervise clinicians. Healthcare is also another major setting in which you'll find SLPs. This would be your hospitals, your acute care rehabs, whether it's inpatient or outpatient. And you also find some of us in the psychiatric facilities. Your residential healthcare is going to be your skilled nursing facilities where you're going to work with the majority of your geriatric populations. There also might be residential healthcare, and non-residential healthcare would be like your at home or in small clinics. A private practice is what we do, and then you would also find us in a corporate SLP position, might be to consult for a company or also in a government agency such as a public health department or uniform services. The educational requirements for a speech language pathologist is you have to have your certificate of clinical competence from an accredited university. You also have to have your clinical experiences, and you have to pass a national examination. If I could give any advice to someone who is looking to be a speech language pathologist, I would just say to do your research, look at different locations, look at various settings in which you find SLPs, and just find the things that interest you. Find the populations that interest you. Do you like to work with kids? Do you like to work with adults? Do you like to work with the medical field or the educational field? There's really a lot of cool things that speech language pathologists do that most people don't know. So I really would suggest that anyone looking to be a speech therapist would just do your research, go observe someone, or maybe job shadow a professional that you know and see if it's something that you're interested in.